Hi, I'm Kate, creator of MyMedPharm.info, a knowledge hub for medical translators and writers. Today I'll help you remember once and for all what the expressions ad hoc and post hoc mean in the context of clinical trials. I'll give you the explanations and then offer a short exercise to test your knowledge. And there will be a bonus somewhere in the middle. So let's begin. There are so many Latin terms in medicine. And if you don't have a medical degree that usually comes with a couple of semesters studying Latin, you might find it hard to remember them all. In clinical trials, the terms ad hoc and post hoc are used to refer to data analysis. Both refer to unplanned analysis, conducted after unblinding or database lock to guide further research or generate hypotheses. What's the difference between them? Well, ad hoc translates from Latin as for this, and refers to when necessary or when needed to answer a specific question. This analysis can occur both during and after a clinical trial. And post hoc translates as after this and refers to unplanned retrospective analysis. Post hoc analysis is always conducted after study completion. Let's put these terms in context. Here is the first example. We recommend an ad hoc subgroup analysis of the trial to identify the targeted population that has the maximal benefit of the promising drug with the least exposure to uncertain side effects. So here, basically, authors of the publication from where the quote comes recommend an unplanned subgroup analysis to identify a population of patients that has the maximal benefit of the drug. And it says the promising drug because the drug has already been tested in the trial. So the analysis is recommended after the trial completion. The second example includes the term post hoc. It says, post hoc analysis of data become relevant in informing practitioners about clinical benefits or safety signals that may not be captured by the primary endpoint. So this statement refers to unplanned retrospective analysis that can be helpful because they highlight clinical benefits or safety signals that were not captured by the primary analysis or by the initial study analysis. Frankly speaking, some authors use the terms ad hoc and post hoc as synonyms referring to unplanned retrospective analysis, or they don't differentiate the retrospective analysis and unplanned analysis during the trial and use these terms to talk about unplanned analysis. If you want to learn more nuances, check the link in the description. It leads to a blog post on MyMedPharm.info website. So here is the promised bonus. There is also a regular expression on ad hoc basis. Here is an example. It says, if implemented, this function is often used as a means to dispense drug on an ad hoc basis. For example, if a subject is going on vacation and will need more drug than usual, or for specific unpredictable scenarios, for example, to dispense rescue medication in case of an adverse event. So, as you can see, on an ad hoc basis means as needed or when necessary, and unplanned use of the drug in this case. So now that I've given you all the definitions and explanations, it's time to test your knowledge. I'll give you 3 statements and you'll have to decide whether they are true or false. You can pause the video if you feel you need time to think. Number 1 says, post hoc analysis examine hypotheses that are conceptualized after the data are seen. Is the statement true or false? This statement is true because the expression "the data are seen" refers to unblinding and database lock and proper planned analysis of the data. And post hoc analysis examine hypotheses that were generated after the study completion. So here is the second one. Post hoc analysis from the ADAPT clinical study were powered to demonstrate the aggregate sustained benefit of efgartigimod in generalized myasthenia gravis. Is the statement true or false? So this one is false, because post hoc analysis are conducted after the study completion, and they are usually underpowered because no one accounts for them in the initial study design. In the vast majority of cases, I can't tell for each study, but in general, post hoc analysis don't have any statistical power. Number 3, ad hoc analysis of a clinical trial can explore any hypothesis, even if it was not initially planned or accounted for in the trial design. Is this one true or false? This one is true. Ad hoc refers to unplanned analysis. It doesn't have to be accounted in the trial design, so it can explore any hypothesis. Have you answered all 3 questions correctly? Please share in the comments. And remember, there is a link to the blog post in the description. Thank you for watching, and see you next time.